Everyone. This is Dr. Fox, and let's talk about anatomical regions, planes, and directions. In this video, we'll give you the understanding of higher-level anatomical regions of the human body. We'll discuss anatomical planes and standard anatomical position. And finally, we'll discuss the use of relative anatomical directions. These are all such crucial concepts in being able to effectively communicate regarding human anatomy. So let's begin with anatomical regions. There are different regions or parts of the body, and many of these regions have more granular or fine-scale parts to them. So let's take a look at just some of the larger parts, and many of these will be discussed in the context of different blocks within this course. So starting at the most superior, which is an anatomical direction, is the head. The head articulates with the neck. The neck articulates with the thorax. Thorax is in communication or articulation with two upper limbs and the abdomen. Now, each upper limb, you'll see, is segmented into different regions, and these will be discussed in MSK. So, for instance, there is an arm, a forearm, a wrist, and a hand. And of course, we can go into even further distinctions with respect to things like the hand. Now, going back to the main torso here, the torso would be the collection of the thorax, the abdomen, and the communication with the abdomen, the pelvis here, be those three elements. The pelvis articulates with two lower limbs, and the lower limb consists generally of the thigh, the leg, the ankle, and the foot. Now, as you've seen, we can group regions and parts, such as when we discussed the torso or the trunk of the body. We can also describe regions to the exclusion of larger regions. So we can go from the torso to specifically talking about the abdominopelvic region. Now, you may hear various synonyms, some of them proper, some of them more colloquial or informal. So, for instance, some people may refer to the thorax as the chest, in particular the anterior part of the thorax and lateral parts of the thorax as the chest. And this is fine. It's good to know that there are different names for the same thing. In our discussion of anatomy, frequently we will employ both visuals and either written or verbal descriptors of relationships. And oftentimes we find it helpful to use various anatomical planes as a means to show or demonstrate anatomy. Now, there are four major planes, and there are other planes, but they can be discussed in a different context and a different video. So the first that I would mention is the coronal plane. So we can see this young woman standing here, and she is divided into anterior and posterior portions by a frontal or coronal plane. Coronal refers to as a crown, so if a crown were to be seated upon the head, it would sit in that coronal plane. And this plane establishes anterior versus posterior. And it can be at any point along the organism. So we can move or advance this plane forward such that it would just, divide the anterior nose from the posterior nose and the rest of the body, or we could advance it backwards so as to separate this individual's ponytail from the rest of her body. Turning our attention over here to the left, we can see that there are also planes that are going to divide sides. So the first of which is a particular type of plane that divides along the middle or the midline, and we call this a median plane. So here we can see the median plane dividing this person into left and right parts. We can also take that median plane and apply it to subparts. So for instance, here we can see the median plane of the hand or the median plane of the foot, which would also here include the ankle and distal leg as well. You may sometimes hear median referred to as mid-sagittal. So let's talk a little bit about the sagittal plane. Sagittal planes divide right from left, but they're not perfectly in the midline. So it might be useful to take a look at the thigh using a sagittal view, and that might divide the thigh into an imperfect right thigh versus left thigh. So the important nugget here is that median and sagittal planes are going to divide right from left. Median is right in the middle of either the organism or the structure being discussed, whereas sagittal is not perfectly in the middle. Our final plane is a transverse plane, oftentimes referred to as either an axial view or a cross section. The transverse plane is going to set a boundary between something that's superior versus something that is inferior. And so here we can see this transverse plane cutting across both the abdomen here, as well as what looks like the popliteal fossa, as well as maybe the proximal forearm there. It's difficult to see the exact position of that. So, to review, frontal planes, anterior versus posterior. Median and sagittal planes are right versus left, with median being perfectly in the midline of the object being discussed. And transverse planes are going to divide superior from inferior. Let's take a look at standard anatomical position using this same young woman. So in standard anatomical position, the person is standing with their feet flat and parallel upon the surface that they're standing. They're facing anteriorly, and their heads and the palmar surfaces of their hands are facing forward. That would put their thumbs laterally. And their toes are also facing forward. In the very specialized case, this does come up within the reproductive sequence, if a penis is present in standard anatomical position, the ventral surface of the penis is facing anteriorly, so as if to represent an erection, which is always a bit of curiosity that elicits smiles or giggles or is interesting trivia to share with your like-minded anatomically oriented friends. Now this standard anatomical position is going to set the standard for our discussion of relative positional terms. So let's take a look at this, still using our friend here and the various planes that divide her. So as we use anatomical directions, it's very important, it's absolutely crucial that we understand that these are all relative terms. So to give you an example, cardinal directions, if you're talking about locations, you would never say Ann Arbor, Michigan is east. You might say Ann Arbor, Michigan is east of Chicago, or it's west of New York City. And likewise with anatomical directions, we would say that one structure is something relative to something else. So we can pair up these directions into buddy pairs or directions. So we can think of superior versus inferior, superior versus inferior. And we'll discuss these in more detail in the slides to come. We can also have lateral or medial. We can have anterior versus posterior. Or we can have proximal versus distal, as well as superficial versus deep. So let's take a look at these directions and give some examples. So when we say that a structure is superior to another structure, we mean that it is nearer to the head or the cranium. We could even say that structures within the head are superior or cranial to other structures within the head. So the tippy top of the head there would represent the most superior portion of the body. Likewise, we can say something is inferior if it is moving down towards the feet. Sometimes we hear inferior referred to as caudal. Caudal refers to the tail. Humans don't have tails, but we do have a vestigial tail that articulates as part of the pelvis called the coccyx, which you'll learn more about in MSK. So to apply these terms, we can think of the neck being what relative to the thorax. So the neck is superior to the thorax. Now we can then say that the inverse is true, or that the thorax is inferior to the neck. Moving on, we have our paired anterior versus posterior. Anterior sometimes we refer to as ventral, whereas posterior we refer to as dorsal. These are things that would be separated by a coronal plane. So in standard anatomical position, the palms of the hand are anterior or ventral, whereas the backs of the hand are posterior or dorsal. So to apply this, we can think of the nose being what relative to the ear? The nose is anterior to the ear. And inversely, the ear is posterior to the nose. Good, let's move on. Superficial versus deep references the layered aspect of the body. So deep would be nearer to the core, and superficial would be nearer to the surface. Keep in mind, superficial and deep can sometimes, in certain situations, be used synonymously with many of the other anatomical directions. So if you're talking about, the top of the scalp here, this hair might be superficial to the skull, and it also might be superior to it. So usually we use superficial and deep with reference to depth, where it's more appropriate referencing it that way. So for instance, when we think about the lungs within the thoracic cavity, we would say the lungs are deep to the thoracic wall, or that the thoracic wall, inversely, is superficial to the lungs. Let's move on. Versus lateral references the nearness of the structure to the median plane. So if we look right down that median plane, anything near to that plane is medial, anything farther from that plane is lateral. So for instance, the heart is what to the lungs? The heart is what to the lungs? The heart is medial to the lungs, or the lungs are lateral to the heart. Now let's move on to what is oftentimes the most challenging set of anatomical directions for students: proximal versus distal. So proximal references, in terms of the overall layout, structures that are closer to the origin, oftentimes the trunk if we're talking MSK, whereas distal points to structures that are further from the origin. We can also use this to describe the relative positions of portions of tubes, vessels, and nerves. But you always have to ask yourself, what is the origin of that tube, vessel, and nerve? And the origin would be more proximal, and the end would be more distal. So in this case, looking at the hand, what would the hand be with respect to the wrist? The hand would be distal to the wrist because it is farther from the origin up here at the shoulder than is the wrist. The wrist, therefore, would be proximal to the hand. Very good. Now, I'd really love it if you can think about the various parts of your body and start to practice these anatomical terms to identify the relative positions of structures on your body to one another. Thank you so much for your time and attention. And if you have any questions, please do feel free to reach out.